Good morning, everybody. It's Dr. Polak from Progressive Pediatrics in Union City in Bayonne, and I want to give you an update today about the COVID pandemic. So, some good news, some not so great news, but I think knowledge is always good news so that we know a little bit more today than we did 4 months ago when the COVID pandemic started so hard here in New Jersey. So, there are four main things that I'd like to discuss that we now know a little bit more certainly than we did before. Number one is that initially we thought that COVID-19 was a respiratory disease, a disease like the flu that gives you cough, runny nose, and pneumonia. The answer is no, that's not the case. It's actually a disease of the vessels. So it causes inflammation in the blood vessels, and it can affect any organ in the body. So we are much more careful now in diagnosing COVID-19 because we know it can affect any organ in the body. And we know a little bit better how to diagnose and manage the COVID-19. So that's number one update. It's not only respiratory, it can affect your lungs. And yes, people do get pneumonias from it, but it's mostly in the blood vessels in the lungs or in the kidneys or in the hearts that are being affected by the COVID-19. That's number one. Number two is that this virus is mutating about every 2 weeks. So there's a major change in this virus every 2 weeks. We know of two main strains that are in the United States. And again, there may be many more, we don't know for sure, but we know on the West Coast, there's a strain that came from China directly, and then on the East Coast, it came from Europe, and they're a little bit different, the strains. So we know a little bit more about the mutations and the strains of the viruses. Number three, we know that the virus is much less likely to be transmitted outside than inside. So a big study that was out of China showed that you're 20 times more likely to get the virus indoors if exposed than outdoors, 20 times more. So what we do know is that outdoors is much safer than indoors, and absolutely try your best to avoid crowds. Number four thing we know is that kids usually get inflammation if they get it, and sometimes they get absolutely no symptoms if they're exposed to COVID-19. So they have asymptomatic disease of the COVID. So therefore, if kids get inflammation, they're less likely to transmit it because they're not coughing and sneezing it all over everyone. So Finland and Denmark have opened their school systems in April and in May. And so far now, as of July, they have not seen a significant uptick in the number of cases of COVID-19 in those two countries. So we are looking at those numbers and hoping that in our country, we can do something similar, where we can understand that the small children are not a major transmitter of this virus, that the majority of people who get this virus, it's the parents giving it to the children, not the children giving it to the parents. Again, this is still up in the air a little bit, and we are using two small countries like Finland and Denmark to look at exactly how the school system opening has affected the numbers. But that's the fact. That's the update I wanted to share with you today. So basically the bottom line is this: we know what is safer to do, but we don't know what is absolutely safe to do, because we don't think anything is 100% safe to do, to be honest. So as your doctor, I'd like you to understand that when you ask me those questions, I'm going to say this is safer than that, but I'm not going to be able to say to you, this is definitely safe for you to do. That's the bottom line. If you do choose to send your children to school, and I hope you do if they open, children should really wear masks. Anyone over the age of 2, we recommend that you wear masks, and that if your kids do go to college, they should absolutely wear masks. And in order to keep the numbers at a normal, at this level, and not for the numbers not to go much higher, if the kids do go to college, then all the kids in college really do need to be tested frequently, like between every 2 to 3 days and every week, whether they have symptoms or not. So testing everyone in a small community that is enclosed, like in college, can help outbreaks from getting very big. So if we open our schools, once again, we have to have the kids wear masks. And in college environments, especially if there are dorms, we're going to have to test everybody every 2 to 3 days, or at least every week. And that would make things safer a bit. So what's happening this fall? We don't know yet. Okay, we're doing our best to figure this out, but we can try to predict what's happening. We are strongly recommending that you get your children and yourself the flu vaccine. We don't want to wind up with a fall where we have high COVID numbers and high flu numbers on some patients who have both COVID and flu simultaneously. So that way you have both inflammation and respiratory symptoms. So please do your best to get your children the flu vaccine, which is not available right now, but in September it will be available. So we'll let you know when we have it, and we're hoping you come and give it to your children and to yourselves. Lastly, I want to talk a little bit about herd immunity. So people are saying out there, oh, so many people are getting it, so many young people are getting it, maybe we're going to get to herd immunity anyway. The answer is no. That's not the case. To get to herd immunity, we need 60%, 60% of the population to have protection against this disease. But at this point, with the US population being 330 million and us only having 3 million, which does seem like a huge number, it is, but it's only 1% of the US population that have gotten the COVID-19 testing positive. That 1% is not going to get us to herd immunity. And I don't ever want us to get to herd immunity by getting the disease, because that means a large number of people will die. So let's hope that's not the case. Let's hope that's not the case. So this week, especially, the WHO said, oh, now we think that COVID-19 is being transmitted by aerosols, indoors only. That's the news from this morning. So let me talk a little bit about that. Whether it's droplets, which are larger than aerosols, the COVID-19 is transmitted when someone talks, coughs, sneezes, etc. So there are three main ways to do your best to stay safe, whether it's aerosol transmission or droplet transmission. Number one, increased ventilation. So being outdoors, or if you're indoors, don't be in a place where there's no good ventilation. Number two is filtration, preferably HEPA filters. And number three is decreased crowding. We're doing all three of those in our office to make sure that you're safe. Number one, there are no patients that wait in our waiting room. None of our patients wait in our waiting room. They come from their cars directly into the exam room, and the door is closed on that particular group, and that's it. No crowding, number one. Number two, we're only asking one parent to come in with each patient to decrease crowding. Number three, if you don't have a car, we'll give you an appointment first thing in the morning so that you don't have to worry about waiting downstairs or any such thing. How are we increasing ventilation? We have a fan in the ceiling of each exam room. As soon as you leave, we turn off that fan, and we leave it on until the next patient comes in at least 10 minutes, so that you're not coming in one after the other, forgive me. So we are increasing ventilation in each exam room, and we have an air purifier for the entire office. How are we increasing filtration? We have bought some huge HEPA filters, construction grade HEPA filters. If you walk into our office and look behind where the receptionist sits, you're going to see these huge red machines that are on dollies because they're too heavy for us to carry. And what we do is, after each patient leaves, we take it into the exam room on the dolly, leave it in there to scrub all the air in the room. So these HEPA filters scrub all the air in that room from any viruses and filter it within 10 minutes, so that when you come upstairs from your car, that room has been sanitized by wipes, by the staff. The room has also been ventilated with the fans, and it has been filtered with our HEPA filter. So those are the things we're doing to keep you safe. Whether it's droplets, aerosol, or both, we're protecting you, and we want you to know what the updates are about the COVID-19. So again, this is Dr. Polak from Union City in Bayonne, New Jersey. I'll be happy to answer your questions in person. If you'd like to contact our office for an appointment, either virtually, we can do virtual visits. We can also do in-person visits in the office. So give us a call, make an appointment, and we'll be glad to answer your questions. I hope you have a great weekend. Bye-bye.